Hello everyone, this is my final presentation for Bio 318. I chose the epidemic HIV/AIDS. So HIV is also known as human immunodeficiency virus, which is a virus that attacks the body's immune system. HIV infections in humans came from a type of chimpanzee in Central Africa. The chimpanzee version of the virus, also known as simian immunodeficiency virus or SIV, was probably passed to humans when humans hunted these chimpanzees for meat and came in contact with their infected blood. Studies show that HIV may have jumped from chimpanzees to humans as far back as the late 1800s. HIV/AIDS was known to be in the US as early as the 1970s. HIV has 3 stages. The first stage is known as acute, where people have a large amount of HIV in their blood and they are very contagious. The second stage is chronic, where HIV is still active but reproduces at very low levels. And the third stage is full-on blown AIDS, where people with AIDS have such badly damaged immune systems they get an increasing number of severe illnesses. So AIDS is the most severe phase of HIV infection, and people who progress to AIDS have very damaged immune systems and they become increasingly sick from many different illnesses. Even a common cold can cause lots of issues with someone who has AIDS. People will receive an AIDS diagnosis when their CD4 cell count drops below 200 cells per millimeter, or if they develop certain opportunistic infections. People with AIDS can have a high viral load and be very infectious, and without treatment, these people can typically survive about 3 years after they get AIDS. The most common transmission of HIV is having unprotected sex with an infected partner or sharing needles with someone who has HIV. There are other ways of getting HIV, but they are mostly limited now due to advancements in the medical field. However, one possible transmission is from the infected mother to a fetus when they become pregnant, or infection from other blood products. So symptoms for HIV and AIDS can vary from person to person. Some people have flu-like symptoms within 2 to 4 weeks after infection, and symptoms may last for a few days or even several weeks. Some possible symptoms include fever, chills, rash, night sweats, mouth ulcers, fatigue. However, some people may not even get sick during acute HIV infection. This is why it's important to get tested when sexually active or when you are unsure. And just because you have these symptoms does not mean you have HIV. So the image to the side shows the different stages of HIV and what can happen during each stage, going from acute infection to AIDS. So HIV and AIDS has been a very stigmatized disease. It has existed in the US since mid to late 1970s. However, the CDC started noticing and tracking cases of the disease in 1981, starting in gay men. In the early and mid 1980s, rumors of a gay disease or gay plague spread, which started misrepresenting AIDS as a threat only to homosexual men. The disease was originally called gay-related immune deficiency, or GRID, and discriminated against homosexuals or those infected with the disease. There was a stigma with homosexuals or those who had the disease, and they would be isolated from society, and people actually believed that they deserved the disease for doing bad things like drugs and using needles or even being homosexual. People didn't know how it spread, so society tended to stay away from those that they believed were infected or could get infected. This caused many people just to be isolated, kicked out of schools, kicked out of work, and slowly the CDC learned that it cannot be spread through simple interactions and it gets spread through blood or other bodily fluids. However, people did not listen, or they were still scared, so they continued to discriminate against those who they believed to have it or be able to get it. Today we know that anyone can get HIV/AIDS, not only homosexual men. So that is why it is increasingly important to know how to protect against it and be educated on the topic. So the medical community views on HIV and AIDS has consistently been changing. More research has been done to see treatments for HIV and AIDS. However, there is no cure for the disease. You will always live with it once you get it. And there are more than 30 antiretroviral drugs approved by the FDA as of today to treat HIV infection. When used consistently, HIV drugs, also known as antiretroviral therapy or ART, can reduce the amount of virus in the blood and body fluids to very low or undetectable levels, and this is also known as viral suppression. People living with HIV who start the antiretroviral therapy early on and remain on treatment and obtain that viral suppression can stay healthy and live an almost normal lifespan. Treatment also confers enormous prevention benefits, and in recent studies conducted to date, no case of HIV transmission has been linked to someone who has had a suppressed viral load. However, there are numerous disparities in HIV treatment and care among certain subpopulations in the US. So even though many drugs are being researched and put out to the public to help with HIV and AIDS, there is discrimination towards patients who have this disease. People have a big fear towards HIV and AIDS, and this stays true throughout the medical field, actually. Patients have discussed being rejected by many doctors, by dentists, by places of work, and for having this disease, and it's discrimination. HIV and AIDS is common within lower socioeconomic classes, and these are the people who are least likely to afford the drugs. And these drugs can be expensive, so not many people can get the treatment that they need and continue to spread it, or they can't even get access to healthcare professionals so that they can get the drug in the first place or see what their options are. So additionally, many people don't even know they have the disease because they aren't getting tested or they're not educated on the topic. That is why it is important to discuss this with all ages and begin early on how to prevent from these things happening or prevent it from spreading. So finally, here are my citations, and thank you for listening.